move along. So this is our agenda for the evening. We've gone through the housekeeping items. We'll introduce the COVID response committee. This is the group that has been working on a lot of the policies and research that we're about to discuss. We'll get a report from the chair and the health sciences team, and then we'll have a report from the board of directors, and then we'll move into the Q&A. In general, if you have sort of an urgent question, you're welcome to post it into the Q&A during any of the reports before the Q&A, and we'll try to get to it as soon as possible. Otherwise, if you leave your question sort of, for the end, that's also perfectly okay. All right, so the members of the COVID-19 response committee are Stuart Sankey, who is the committee chair, Christy Rollick is the club manager, Chris Way is the president of the board of directors, myself, I am the acting secretary. We have a protocols working group comprising Patrick Boyle, Peter Krombalis, Kevin Sims, Kate Wash, and the health sciences working group of Rob Bryan and Tom Deary. Okay, and so we are going to have a report from the chair. Stu is not on the call yet, so we will maybe save that for the end of the presentation. And right now, Tom Deary and Rob Bryan will present a brief sort of primer on aspects of COVID-19 that are relevant to you who have joined us and the club. And they'll do a bit of a brief on what we've been doing as a community to help us operate the club safely in the face of the pandemic. So I will now pass this on to Tom and Rob.
Perfect. So sound on. Let us know if you can't hear us because we're both masked, as is appropriate protocol for COVID. I'm Tom, and Rob Bryan is with me here. You probably know us as people who are not very good curlers, but we also work in health sciences. And so we're going to do a run through of a quick primer about COVID as it applies to us as the club, and also then we're going to talk about the measures that we have recommended, and we'll give you a chance to ask some questions. The first thing I'd want to say, if we could go to the next slide, please, is that the reason that we're doing this, of course, is that this is a community of friends. You're our friends and loved ones. And so we want to do what we can to make sure, in short, that we can come back to the club, curl, socialize, and do the things we normally do there in as safe a possible situation as we can, and take all the reasonable measures we can to make you and your loved ones safe. We also want to give you the information you need to make informed choices about curling and try to have as enjoyable a season as we can in the face of a pretty tough time. We've had the club here for 110 years. Many of you were the people who steered us through tough times in other tough situations. So I'm sure we'll come through it again in flying colors as we have in the past. Next slide. So what is COVID-19? Everybody knows this already. It's a viral respiratory illness that is caused by a coronavirus called SARS-CoV-2. And it's spread primarily by physical and respiratory contact. Physical contact is significant, but not thought to be the biggest one. Respiratory is thought to be the biggest, but physical contact is still a significant number. Next slide, please. So for physical contact, basically, you pass the disease along or get it by touching people who are infected. They've got their snottiness on themselves, or they put their snotty hands on surfaces that you then touch you pick up the virus, you touch your nose or your eyes or your mouth, and you get the illness. And basically, the busier the surface, the greater the risk. By respiratory route, we spread the disease both by droplets and aerosols. You hear a lot about droplets, but basically both of these are particles of mucus and saliva that you shoot out of your mouth, and they carry lots of virus with them. Next slide, please. Droplets are called droplets because, it's not because they drop, but that's how you remember what they do. They're larger particles, and they can either be visible, like a line-dried ball of goo that you sneeze or cough directly into somebody's mouth and give them the disease, thank you very much. Or they can be microscopic, even small enough to go through a loose weave of cloth without any problem. The thing that separates them from aerosols is that they fall to the floor over a space of approximately 6 feet out of their own weight. The bigger the particle, the faster it drops. But they can go as far as 20 feet with a sneeze. You sneeze at 120 kilometers an hour, so you can shoot it pretty far. And we generally spread droplets when we're sick. We show the symptoms, we cough, we sneeze, or if you've got a person who's a spitter, when they talk, say it, don't spray it. And they have saliva that has virus in it, and if they spit when they speak, they can shoot it on you. So getting further away from them or wearing a mask can protect you from getting the illness from droplets. Next, please. Aerosols are also mucus and saliva particles carrying virus, but they are much smaller. And what makes them aerosol is that they can float in the air anywhere from 5 minutes to indefinite. And, excuse me, coughing into my sleeve. All of our current data and an accelerating amount of data indicates that we should treat aerosol transmission through these smaller particles floating in the air as a risk, especially when we're in a crowded space that's enclosed with low ventilation. You'll hear Eileen Davila, the public health chief for Toronto, talking about the 3 C's, closeness, closed spaces, and crowds. And this is kind of code language for the interaction between aerosols and asymptomatic transmission. We spread aerosols by coughing also. We get rid of a lot of aerosols along with droplets when we cough, sneezing, shouting, singing, speaking, and even to some degree, breathing. So we reduce our exposure to aerosols by distance as well. The closer you are to the person who's infected, the more aerosols you expose yourself to. Also, some good masks will prevent aerosol transmission. And in some environments, it's feasible to take air quality measures, which we'll talk about a little bit later. Next, please. But one of the things that's really important to know about COVID for a curling club is that it does spread without symptoms, either before you get symptoms. Our most infectious period for most COVID patients is 2 days before and 2 days after you start to show symptoms. But also many people who are infected never show symptoms. Some very large studies have demonstrated that as many as 30 to 70% of people who get infected and may or may not be infectious, we don't really know too well, they can never show any symptoms. And basically, the younger you are, the more likely you are to not show symptoms when you're sick. But even people over 60 have been demonstrated that 30% of people over 60 who are infected never show any symptoms and might be infectious. So the take home for us as High Park members is that we need to, in our safety protocols and our behaviors as friends and neighbors, is to consider the fact that people walking into the club might feel fine, they might not appear sick, but they may be infected and may be able to spread the disease to you or your loved ones. So having known that, what are the factors that increase transmission risk? Well, they're pretty well established, and these are the ones that are most important to us. Given these 3 transmission modes, these are the ones that are real important to us. First of all is close proximity. The closer you are to the offending person, the higher your risk. So physical distancing measures from the government and the adherence to them by the public have been a major factor in bringing caseloads down. And when we're at the club, we want to make sure we distance as well. Enclosed spaces, especially where there's reduced ventilation, risk goes up because aerosols can accumulate and you tend to be closer. The more people you have, the more risk, because there's both a greater likelihood that an infected person walked into the room, and if there's more than one, they can eject more virus into the air. And sustained contact is something you'll hear Eileen Davila talk about, Isaac Bogosh, or whoever you watch on TV. The longer the time, the longer you have to get exposed, and also the more virus that can accumulate in a closed space. And finally, for you athletes, not skips, people who actually sweep, energetic breathing from robust exercise or loud talking or shouting or singing. I know Mike Spiniarski is out there somewhere. Singing is something that will shoot virus out of your airway. All of these things will increase your particle expulsion. So those of you who are pretty sharp and on the ball, you'll notice that all 5 of these things apply to our curling lounge. So we need to take measures to reduce the risk and make the environment safe for you to come to the club and curl. At this point, I'm going to hand it off to Rob. I'm a human biologist with a background in infectious disease and immunology and pathogenic micro, both in a research and clinical environment where we had to contain virus. But Rob is a boots on the ground medical professional. He's an anesthesiology assistant, a paramedic, and also a quality assurance professional in areas applying to that. Did I get your qualifications correct, Rob? Pretty much. Okay, so I'm going to turn it over to Rob and let him speak to you about what you can do to protect yourself.
Thank you, Tom. So first, I want to thank Christy and her team at Hyde Park for dedicating themselves and putting themselves through our ropes when we were doing all the training with them. Our focus has been to try to incorporate best practices around infection control, as well as focusing on decreasing rates of transmission throughout the club to create the safest environment for the staff and for our members. That being said, Tom did a great job explaining what is coronavirus and how is it transmitted. And I'm going to talk a little bit about how we've created protocols and processes at the club that help to mitigate these risks. So talking about contact, the main thing for us at the club is we want to try to avoid touching people. So that means no handshaking, hugging, or touching people outside of your immediate household. I know that it's been our normal practice to shake hands before the games. These are things that we're going to have to change, particularly while we're trying to maintain our social distance and not trying to contaminate each other, so to speak. The other thing that we can do to decrease the risk of contact transmission is frequently wash our hands. And at the club, they're going to have hand washing sanitized pretty much in every aspect of your reach within the lounge and on the ice surface, as well as bathroom hygienes. There'll be posters in the bathrooms about hand hygiene and reminders about wearing masks and cough hygiene. And the other thing that is going to probably be the biggest challenge for us is how to avoid touching our nose and our eyes, because that's how you become a vector of transmission by this habit that a lot of people don't realize that they have. So it's something that, again, wearing a mask can help tailor your behavior, because there'll be a barrier to remind you not to touch your face. From a respiratory perspective, and again, this falls in line with all the public health mandates and the government guidelines that have been put out, is to maintain proper distancing. So 6 feet or 2 meters allows for the large droplet particles to drop between 2 people that are talking. And the farther apart you are, the less risk you are of being hit by particles. Coughing and sneezing hygiene is another big factor. So we all have to focus on, and then this seems like common sense, but how, when we feel the urge to cough or sneeze, is how do we protect others from being hit by projectiles? Particularly coughing into your sleeve is an important one. Even if you have a mask on, coughing into your sleeve is important to have it. And the most important thing that's coming out now, and you've probably noticed this in the news in the last couple of weeks, is mandatory masks indoors. And the reason is there's a lot of research now that shows there's a major decrease in particle transmission when you wear a well-fitted mask. And this is something that we'll be applying into our club as a way to decrease exposure. Next slide. Okay, so what else can you do to help decrease the chances of transmitting or catching the virus in the club? So I see that yesterday the club had posted on the website a disclaimer and a waiver, and it's actually quite effective if you look at what the public health data that's coming out and how they're guiding people's behavior in the community. So one thing that is going to be mandatory going forward is that you're going to have to do self-screening before you come to the club, and you're making a declaration that that you've actually screened yourself, that you have no symptoms, that you haven't traveled to an area that there's an outbreak, there's somebody that's in your household that you have close contact that doesn't have it, as well as if you have it, when it's safe to come back. Okay, so we prefer the Ontario Ministry of Health's COVID-19 self-assessment. Now, it's a great self-assessment tool if you get an opportunity to look this up after this presentation. Not only does it guide you through the self-assessment tool, but if you're positive, it tells you which infection control clinic that you can contact for further investigation, or what to do if you have a symptom, such as contact your physician or where the COVID clinics are. The Ontario government's done a phenomenal job with their self-assessment tool. If you have any symptoms, stay home. Don't come to the club. Don't take the risk that you may spread it to other people in the club, which could potentially result in the club shutting down if we have a major outbreak or a death, heaven forbid. Follow the club protocols, and we all want to protect each other. So the club protocols, again, there'll be more messaging going out about this just before we get into the curling season, but a lot of it is going to be based on public health guidance and some common sense.
Yeah, and I would add that, this is where we work together for each other's benefit. Every time you follow one of these protocols, you're doing a favor to your team, your teammates, the people that are our social life, the people we love. We're actually caring for them by following these protocols and taking care for the people in our lives. And that's been our practice, how we've come through a lot of things in the past. I think this is how we're going to get through this together in this crisis. So now I'll talk a little bit about something that we really we feel like we have a responsibility to measure, because COVID is not an even-handed disease. It's primarily an adult disease, but it affects the population in a very uneven way. 72%, and this is data from Health Canada today, 72% of Canadian fatalities are in patients over the age of 80, and 90% are over the age of 70. Also, the other major risk factor is pre-existing illness. And these numbers are more variable because how they report pre-existing illness is different. But in general, you can take a number of over 80% of hospitalizations are in those people with a serious pre-existing illness, mostly cardiovascular and respiratory, but not limited to that. There are other risk factors. If you're a man, if you're blood type A, if you're bald, I hate all three of those because I am in all of those risk groups. And I don't think wearing a toupee like Donald Trump is going to help me. But the major risk factors really are age and whether you have a pre-existing illness. So it's incumbent on us to give you the advice that if you have a serious pre-existing illness, please talk to your physician about curling. Describe what our curling environment is, including our safety protocols, and have a conversation. And then you can, in an informed way, make a decision based on the recommendations of whether to curl this year. My dad is 80, and he had a valve transplant. So he's living his life as an 80-year-old. He's protecting others, but he's going out and living his life and taking some risks. But my advice to him is to give curling a miss. If you have a family member who is at home and is immunocompromised, maybe they've had chemotherapy or something like that, please chat with their physician, have a conversation. They may say, yeah, it's fine to curl, but really talk to your healthcare provider, because these really are the major risk groups, and the risks are quite staggeringly different. And if I could see the next slide, I'll show you how different they are. This is a Health Canada graph from July 26th. This is yesterday. It looks complicated, but it's not. It shows that of the people who die of this illness, 72% are over 80, and their risk is 10 times that of people who are between 60 and 69. And for people between 60 and 69, their death risk is 10 times that of people between 40 and 49. And for people 19 and under, 1 Canadian has died. And don't quote me, but I believe that one person had a serious pre-existing illness. So this is disproportional. Now, you may have heard talk about this is a young person's disease too, but I think what we really want to focus on is that young people are not getting seriously ill, but young people are getting infected at a very high rate, but they don't get seriously ill. They don't know they're sick. And if they don't obey protocols, they're killing their grannies and their moms and maybe their brother who has serious asthma. I have 2 nephews, 21 and 18. My sister works in a healthcare environment, and the younger one has serious asthma. And there are some pretty serious protocols going on in that household, because if a young person were to die, it would be my younger nephew. But also, we're trying to protect all the people in their lives. They've got grandmothers, mothers, and so on. So my comment to our young members is that your obeyance of protocols, you may not know it, and you're never going to really know for sure, but you are actually, number one, helping shut the pandemic down, but you're also saving lives. If you behave in too cavalier a way, you might never know it, but there is a good chance you might kill somebody, and it might be somebody you know and love. So the very fact that young people don't show a lot of symptoms is one of the reasons that we want them to be careful, because we don't know when you're sick, and we don't know when you might be transmitting the illness. Next, please.
Okay, so the next slide just kind of shows you some of the safety precautions that were brought into the club and that the staff have dedicated themselves to. And these are also some of the habits that we would like our members to adapt. So particularly, we'll talk a little bit about masks. There are several different types of masks that you can get, and they're acceptable for bringing into the club. You can have a standard paper-based procedure mask that you may see at your doctor's office, or if you go into the hospital for a procedure. And they're good for stopping particles from coming out of you to a certain degree. Now, those types of masks that you may see in a healthcare setting can escalate all the way up to what we call N95. And there's ones that are coming out of Asia called K95s. And they're highly rated and tested in a lab environment to stop certain small particles from coming out or even coming into you. They tend to be tightly fitted around your face, as well as they can be a little bit challenging to breathe through over a longer period of time. So the N95 is probably the highest level of mask that you could wear without actually wearing a self-breathing apparatus or a mask that has cartridges on. So the other mask that's acceptable to use in the club is you could say a market mask. So these are masks that are made by companies that have very specific quality assurances that they have to follow. They usually have a 2-ply cotton or cotton polyester blend that will help stop particles from moving through. In some of these masks that are made by different vendors, you can actually insert a filter into them, and they're excellent as well for our type of application at the club. Now, the third mask that you can look at is one that you can make yourself. And if you look on the column on the left, it kind of goes through how to make a mask for yourself. I suggest that you use materials that have a tightly woven cotton. You may find that the more layers that you put into this cotton mask, the harder it is going it's going to be to breathe through. Things that you don't want to wear is you don't want to wear a balaclava or a scarf over your face, because it's not going to provide you the same type of transmission control from what you're spitting out or what you're exhaling out or even what you're breathing in. The other thing that you want to be careful of is being able to keep an eye on your mask to know when it's getting soiled and when it needs to be cleaned. When it gets too moist, they're not effective and they become a vehicle of transmission. So that's what it comes down for masks. Now, the other thing that's really important about masks is who should wear a mask and who shouldn't wear a mask. The guidance from public health is that everybody should wear a mask unless you suffer from a disability that makes it difficult for you to breathe, such as COPD, or you have another respiratory illness, in children that are under 2 years old. Okay, next slide. So if I have symptoms or I test positive, when can I come back to the club? And that's probably is a concern that all of us would probably want to know. So the most important thing is the self-screening tool and identifying that you have a symptom, and then following up right away with a healthcare specialist or your physician to find out if you do have COVID, and they will test you. So the test right now that we have for people that have COVID is called a nasopharyngeal swab. And they actually stick a Q-tip that has a specific medium on it through your nose to the back of your throat. And they take a sample, and it can take up to 2 to 3 days for you to get your results back. So during that period while you're waiting for your results to come back, it's advisable to stay home and isolate yourself. Once you get your results back, depending on the course of your infection, if you're positive, will dictate when it's safe for you to come back to the club. Now, on top of that, before you come back to the club, you should be cleared by your healthcare provider and most likely the public health department will be following your case, and they will also help guide when it's safe for you to go back into the community. So, Tom?
Yeah, so I just want to give you, some of you have probably already had a test, but my wife works at a geriatric hospital, and as some of you know, I talk a lot, and I had talked so much one day that my voice got hoarse. So just as a safety measure to protect her patients, I went and got a test. And even though we knew why my voice was hoarse, that when I got the test, the comment was, the public health instruction was that whether or not my test came back negative or positive, I needed to self-isolate for 14 days and had to be symptom-free. Now, if you had a different circumstance when you went to get tested, they would give you different instructions. But I think the main point that Rob is making is that when you go for a test, you will get instructions from public health that will tell you exactly what you need to do and when to come back. So that's why our statement here is very brief. It's follow your healthcare provider instructions, and you must be symptom-free. And those things will make you safe to come back to the club. Any additional policies from the club, we're not speaking policy here, we're talking health science information. If there are any other policies from the club, they would be added on. But basically, you need to follow your healthcare provider instructions, and you have to be symptom-free before you can safely return and join the fun with your friends.
Right, so now symptom-free, usually your healthcare provider will tell you have to be 2 weeks symptom-free. After you've been diagnosed with COVID from a swab, a negative or a positive swab after that may not be accurate for up to 90 days after you've been infected. So don't rely on the swab, rely on the advice that your healthcare provider will give you. Next slide. Okay, so what are we doing at the club to open safely and reduce the risk of transmission? Well, this is a lot of work that the COVID committee had put together, specifically looking at transmission control planning. So knowing what areas are high touch zones, meaning that there will be a lot of people engaged in different parts of the club where the virus could land on and contaminate surfaces. Looking at areas of how people within the club gather and socialize and move past each other, as well as looking at the physical facility itself. So that being said, We'll go to the next slide. So this is the plan that the COVID response committee has put together to try to create the safest environment for our staff and for our members. And I have to say that it was very detailed. It's very transmission risk focused. And I think that this committee has done an excellent job in bringing in infection control practices and resources to decrease the risk of transmission at our club as much as possible. So generally, we looked at training all the staff and incorporating best practices in infection control within their own work environment, which includes identifying high touch zones, cleaning strategies for these high touch zone surfaces, as well as how they're servicing the members with regards to drinks and providing other services at our tables and running the club. We also went around with the team, including Christy and the members, and we identified over 100 different high touch zones that allowed Christy to come up with a focused plan for our housekeeping vendors to do enhanced COVID cleaning at the club. On top of that, we also did distancing measures. So the distancing measures really going to be how the club runs with the people in it. So we look at the floor plans to help optimize seating to maintain social distancing. We looked at traffic management about how the flow of people accessing the club and leaving the club to minimize congestion and people moving into or bumping into each other. As well as we looked at the bar and kitchen protocols from a perspective of social distancing. And we're looking at technologies that may decrease the need for large groups of members to go up and place orders or to receive their drinks, such as phone apps or other types of technologies. We also looked at physical installations. Specifically, you'll notice when you go back to the club, there are plexiglass barriers that try to create a wall between the members and the staff. And that's, basically for our staff's safety, because they're the ones that are going to be there every day. They're at the highest risk of transmission from people moving in and out of the club. Sanitizing stations and washroom dispensers for hand washing, and our cleaning protocols and strategies. So contact transmission. So we identified high-risk busy surfaces that have an upgraded cleaning regime. The rock handles, for example, something that's going to be disinfected between each draw. We have physical contact distancing rules. Obviously no physical contact, but how people will engage with each other at the club to respect these physical distances. And provision of sanitizers and facilitation of safe practices, specifically in the bathroom. Respiratory droplets and aerosol, again, just to reiterate what we talked about at the beginning of this presentation about safe distancing, keeping that 2 meters apart so that larger particles could fall to the floor. Wearing masks that are high quality and fitted. And we're looking into air quality measures, and we're currently assessing the feasibility of air quality improvements at our club, which we're going to probably bring in a consultant in HVAC and give us some potential suggestions of how we can optimize air quality in our club. So as you can imagine, we have a 100-year-old club, and some of our mechanics are the same generation. So we are looking at any possible way that we could help reduce risk.
Yeah,
Next slide.
Can I just add to that? I mean, this is something that Rob has a fair amount of expertise, and we do have an appointment booked with an engineer. There's no way for the club to, before the season starts, to actually upgrade our HVAC system. That's not feasible. Even if we knew what we wanted to buy and we had the cash for it, and it wouldn't be cheap, it'd never be installed for the start of the curling season. So right now, the engineer is going to come in, do an analysis for us, tell us what HVAC system would give us the air quality characteristics we want, but also he's going to give us an analysis of what kind of portable filtration units we could use to improve air quality in the club. Now, He may come back and say that this is not feasible for this space, and then we will have to go to our other measures. But he may come back and say, yeah, there's an inexpensive way to get 5 air exchanges an hour in the club, and that would drop our viral load in the air from anyone who is sick by a significant degree, and add to our other measures as an added measure with masks and distancing, and that would improve our safety. So we will look at the feasibility of this week, and then we'll report back to the board on what we find. It may or may not be feasible, so we're still asking some of the key questions to deal with aerosols, and this is primarily an aerosol fighting methodology to deal with the new data that we have on aerosols. And it's basically using HEPA filtration, which are very effective at removing viruses from the air. They're as good as N95 masks. They remove 95% of virus-carrying particles from the air.
Okay, thanks, Tom.
Yeah.
So we'll do all the questions near the end.
Yeah.
So we're not ignoring people. We just want to make sure we get through this information.
Sorry. Yeah, we didn't see that there was a question. Don Weston was asking, will there be the chance to get the copy of this presentation at the end? Yes, we will. We'll give this to the board to post on the web. And at any time, if you're interested, you can always just email one of us and we'd be happy to get back to you. I do make the proviso, if you talk to us directly, we're professionals speaking for ourselves. Please don't hold the board responsible for things we say directly to you. Don't hold them responsible for anything that isn't an official club communique.
Okay. And again, just please appreciate that the work that we're volunteering to do, everything goes back to the board, and the board makes the decision what's in the best interest of the club.
Yeah.
Okay.
Yeah.
Next slide. So in the current conditions, is it safe to curl?
That's the big question.
So Tom and I believe that it is safe to curl. I think that, again, I just want to reiterate to everybody that's online that the staff are prepared. They've done an excellent job investing themselves and getting ready for how to change their work practices to decrease transmission and to optimize our curling environment to be as safe as possible. As well as if we have the commitment from our members to follow our suggested practices to decrease transmission and to commit to self-monitoring and screening, I believe that the environment for our club is safe to curl.
Yeah, and I would also add that we've reviewed the Curling Canada Return to Play guidelines, and actually I believe Chris Way helped work on these, so shout out to Chris for that. We looked at them from a transmission control perspective, and given the current number of active cases in Ontario, I would feel comfortable going on the ice. The ice shed is a big space with a big airspace. We have good distancing. We do recommend some minor modifications, and we both believe that even though the law does not require, we believe that we should wear masks on the ice with the current number of cases. That might change if the caseload drops. But with the appropriate anti-transmission protocols, both of us think that under those rules of play, we think it is reasonably safe to go out and curl. No one can bring the risk to zero. You know, you drive on the highway every day, you take prudent measures to protect your life. You can't guarantee you won't get in an accident, but I believe that I would feel comfortable going on the ice, curling right now, one sweeper, one person in the house, Curling Canada distancing guidelines, cleaning the rock handles between draws, and wearing masks. That's one thing that we are big on. We believe that with the current caseload that people should wear masks unless you can't do so because of a medical difficulty.
Yeah, so wearing the mask actually decreases the viral load transmission by at least up to 80%.
Yeah, depending on the quality of the mask, some market masks and homemade masks properly made can be almost as or equally effective as an N95 mask, and they can remove up to 95% of particles. The reality is that with gaps, they do leak. So my guess is most masks are only running at about 60% efficiency. There is data to support that. If you have any appreciable gap, then they're going to be half effective. But even at half effective, they're really providing a lot of extra protection, and we really recommend them. Now, when we get to curling season start, a lot of this will change. This is a highly fluid situation. And our assessment at the time of the curling season starts going to depend very much on government mandate. What's the state of the pandemic and how many active cases do we have in the province at the time?
And so far, we're doing really well in Ontario, so we keep our fingers crossed that we keep going in the right direction. So, is curling safe? And I think we just kind of covered that.
Yep.
The lounge is going to be more of a focus for us over the next couple of weeks as we prepare for the club opening up for curling. Specifically, we're going to be looking at the layout of the club and how to optimize social distancing for the members so we can add a social aspect to what we're doing at the club, as well as looking at certain protocols about how members and staff move and operate on a day-to-day basis within the club.
Yeah. So one of the distinctions we're making here after our summary that we do think curling is safe is on ice, we're pretty comfortable at this point. In the lounge, we need a more careful assessment. It's a smaller space. We're more close together. The airspace is not super ventilated. So we want to make sure our measures are really solid. And what we think about the lounge and whether our goal is to get to the point where we have 2 draws in the club and you can order a drink and sit with your friends and socialize. That's what we are members of the club for. So we will be watching the effective stage 3 opening carefully, and that's going to determine what will happen in September. And I just want to give a shout out to the board. There's a lot of moving parts here, and they are dealing with financing the club, making sure the club survives. And there's a lot of data about the pandemic that they don't have answers to because no one does. So if we can have a bit of patience with them, that will, I think that that's appropriate because they're working hard to make sure we can get back on the ice safely.
Okay, so we haven't forgotten about your questions. We're going to get back to them in a second. But just to sort of highlight, one of our goals here is not only to bring curling back and to make sure that we have an opportunity to be social with each other, but also what is equally important is the viability of our club. So all the measures that we're trying to promote and move forward is to give the club its best opportunity to be socially and financially viable going into the next curling season and until this pandemic slows down.
Okay, so I think we're almost at the end here and we want to pass it on to the board. There was one open question I'll answer very quickly. Someone talked about humidity and virus infectivity and viability. There is some data about how quickly viruses degrade, but in general, within parameters that we control, we would not use humidity to control virus. It's been demonstrated recently by major labs, including the NIH, that COVID aerosolized can remain active for 16 hours in the air. It can infect human tissue after that. And it has run around the world in every different kind of humidity condition possible. So we would suggest that the major transmission control methods are what are going to affect infection rate, whereas the humidity in the air is not really likely to affect it. The ice shed is cool, viruses like that, but that would be mostly concerned about that in surface contact, and we're going to be cleaning the rock handles pretty aggressively, so I think we're safe there. Surface contact's easy to deal with. So we're going to wrap it up because we've taken a lot of time, and we're going to pass it on to Chris.
Okay, thanks, Tom. We're actually going to loop back to Stu as we missed his chair's report earlier in the meeting. So Stu, do you want to go ahead and then we'll pass it on to Chris?
Yep, sorry about that, guys. I have a brand new Mac, so I didn't have Zoom, but now I do, and I'm here. So I think that a lot of information has now been covered, so I think we've got a lot there about what curling is going to look like. The committee has been working really, really hard trying to put everything in place. So I have to give a big shout out to all the members of the committee because they've been doing a lot of research, working very hard, trying to put protocols together and how we're going to get back to curling in the safest way possible. A big shout out to Christy as well and the staff because they have worked so hard in improving the cleaning and the disinfecting. And the board has been very supportive as well. We improved a lot of measures for extra cleaning, disinfecting. So I think with the committee, we've got pretty much a handle on what's going on in the world with COVID-19. So now we're taking all this information and we're working on how it's actually going to look like. What are the protocols going to be when you come to curl? For instance, like masks are going to be mandatory, where you enter, where you leave, the drink ordering and all that stuff. So we're working really hard now so we can get everyone a protocol list, so we can get that out to all the members so they know exactly what the fall curling season is going to look like, and we're going to make it as safe as possible. So that's our next step with the committee.
Great, thanks, Stu. So I now will pass this on to Chris Way for the Board of Directors report.
Thanks, Emily. I will just go through very quickly a couple of things that the board's working on right now and some of the decisions we've made going into the curling season. With the help of the committee, we've been working on policies and protocols to ensure the continued safe operation of the club. And some of those protocols are in place now. Some of them are coming, especially with the commencement of the curling season. Our primary concern has always been ensuring the safety of the community and all those coming into the club. The club has been closed for periods, as you know, throughout the spring and summer while the pandemic risk was high. Stages of reopening are implemented only after careful consideration and implementation of said protocols to ensure the safety of our members and staff, and really anyone that comes down to the club. One key area of focus that we've been working on, of course, is on the financial side, and whether or not we can weather these difficult and uncertain times. We've been working on some financial and cash flow projections. We have budgets for a wide range of possible scenarios and varying levels of reopening. Decisions on levels of reopening and club operations will be conducted with an eye to ensuring the club remains financially viable. That's very important for us. And we've put non-emergency capital spending on hold. There are a couple of projects that we've had to tackle, but some of the sort of optional ones, the nice to haves, we've put on hold for the time being. Any type of government assistance that we can find, CEBA and the Canadian Emergency Wage Subsidy, we've gone after to help us out. So both those programs we're actively participating in, and the enhanced waiver and declaration of compliance, which you've all seen, I'm sure, are now required for all members to sign, and that's so that we can protect the club and its assets. Our focus was primarily on tennis to start in this whole process, and we've developed a set of tennis and summer operating protocols that are in place now. The initial tennis opening allowed only singles play, but we've now expanded that to doubles and to bar service as well. We've also expanded our tennis leave of absence policy. It's been revised to allow members on a leave to be guaranteed a spot in a section on their return, hopefully next summer. Usually tennis members get bumped to the top of the wait list rather than being guaranteed a spot back. So tennis members were given that option. As far as curling policies and protocols go, you are not going to get a lot of information out of us today, unfortunately. We're still in a holding pattern, just like every other club in the country. I can tell you, though, that the early season events that we usually have at the beginning of or the middle of September have been canceled. So that's the HPC Open and the Stu Sales U20 Tankard. Curling Canada have released the return to play recommendations. These policies are only recommendations. I really want to stress that. Curling Canada is working with public health authorities and provincial organizations to try to solidify some of these as guidelines, but nobody's in a place to make those calls for September, October just yet. Our own in-house return to play policies are under development. Considerations regarding possible restrictions to league play, draw capacity, and social activities at the club will be made in consultation with the working group and of course with the sort of local government and public health authorities. There's also a leave of absence policy that's being worked on right now. And it's going to be taking into account returning section and team status and the impact of status on new members who may fill vacancies this season. So those are sort of the big ticket items that we're working on. And as Stu mentioned, we'll have a full slate of those policies and protocols for you, hopefully in the next month or so. I just want to finish off by thanking Stu and the whole COVID committee for their hard work so far and for guiding the board and the club through what has proven to be a very difficult time. As Tom mentioned, I've been involved in navigating the COVID crisis in the sport of curling on a few different levels, including helping put together those return to play recommendations. But I can say with certainty that our club is miles ahead of the majority of curling centers across the country. And that's in no small part to this committee. So I want to thank Stu and everyone who's had a hand in the development of everything we've done so far. I'll also say that the work's not done. So I'll thank you in advance for the things that you're going to be doing in the near future. Emily?
Great, thank you, Chris. So now we will move along to the Q&A section. So if you have any questions, please type them into the sort of Q&A tab thing. So there was one question that was asked earlier that Chris did provide a response to, and Chris, I'll maybe just ask that you sort of verbally for our people on the phone.
Sure.
Go through
There are
that
a few. Yeah, there were a few questions submitted. One was answered live, so I'll leave that one out. But the first question was, the biggest risk to curling must be at the time of sweeping. Will we consider reducing teams to 3 players? It's a great question. The current recommendation from Curling Canada is not to reduce the team size to 3, but rather to just have 1 sweeper in play and 1 sweeper sitting for every rock. So there are sort of, I guess, sweeping rotations being worked on just to help people out with that. In saying that, a team could choose to play with 3 if they wanted to, if they're more comfortable that way. But we're not, as a club, at that point yet for making that decision. If the pandemic gets worse, then we might be in the future. The one other thing I'll add is that the club will be installing social distancing markers throughout the rink, so actually in the ice, that will show players where they can stand to maintain a 2-meter distance from at least a 2-meter distance from every other player on the ice. So some of you may have seen the diagram from the Curling Canada return to play recommendations. It'll be similar, not the same, but similar to that. I just want to also mention that, another question had to do with having a copy of the full presentation. A copy of the slide deck for sure will be put on the club's COVID webpage. So if you navigate to the club, under the menu item about High Park Club, you'll see a COVID-19 response tab, and that'll take you to all this information. And then there was a question about humidity levels, and Tom already answered that.
Great, thanks, Chris. So there was another question that said, can UV lights help? I see that Tom and Rob have provided a written answer to that. Tom and Rob, can you maybe just read out your response, please? You are on mute if you are speaking.
Here we go. Can you hear me?
Yeah.
Yeah. Okay, so Rob and I had both independently looked at UV light. We know that UVC, which is very short wavelength UV light, is effective at killing almost every biocontaminant. But UVC is very damaging to human eyes and skin, so it can't be used during occupancy. And that is when people are going to be there spreading the virus. So its practicality in the club would have to be investigated, and you would only use UVC lights overnight when no one was there. There are also devices you can put your phones in and so on, but they do cost a couple of grand, and you can probably wipe your phone with alcohol. And if we were going to put money into installations like that and say to the board, can we afford this or that, it would probably be another technology, I think. but we would look at the feasibility. There is a new emerging technology called far UVC, and that's extremely short wavelength UV that is very interesting, but it's emerging, and basically it kills virus and bacteria very effectively, but it only penetrates the outer dermis of the skin. Early tests with guinea pigs are that it's not harmful to their eyes over time. And the idea is that we can use it in occupied spaces, but this is emerging. And I don't know of any vendors that sell it. And I do know that it is something where there's still some testing going on. We both watched a seminar on it recently. So it's interesting for the future. It's a great question. I'm glad you asked it. But right now, we don't see anything we could use in the club without some pretty careful feasibility testing. Rob?
Yeah, there are UV sanitizing units. Unfortunately, they cost an extreme amount of money. They're $50,000 to $100,000 to get a robot that does the zapping at night to kill everything. There are smaller units that you can put your cell phones in. And on that note, the cell phones that people are going to be bringing into the club is going to be one of the biggest vehicles of transmission. So that's something that you're going to have to look at cleaning strategy for that.
Yeah. Clean your phone often with alcohol. And
okay.
don't.
Thanks, guys. Okay, so the next question we have is, did I understand that a declaration needed to be signed before each day of play? Where do I find this? So yes, so there is a waiver that needs to be signed once, and there is a declaration that needs to be signed before each day that you come to the club. The declaration is basically just confirming that you're still sort of in compliance with the terms that we need you to be complying with, that you haven't, you haven't tested positive, or you're not awaiting a test, or you haven't been out of the country in recent days. So you can find that. There is a link to both documents on the website under membership, and there's a sort of a COVID tab. And you should be able to find it. It's very close to the top. Okay, so there have been a few questions about will we be reducing the number of people on the ice? So, for example, using only 3 sheets. So I'm going to pass that on to Stu to respond.
Yep. So basically, we're going to have really strict markers in the ice for players to stand after they throw, sweep, and for the other team. So we feel that we're probably going to be using all 5 sheets because the markers are going to have everyone socially distanced. And so I think we're going to be good there, and everyone's going to be wearing a mask when they play. The other thing is, someone mentioned about the changeover. We're working on, and it comes back to the presentation about the flow in the club. We're going to have strict protocols of where you enter, where you leave, where you go on the ice, where you go off the ice. Are we going to hang out and have a drink after? Social distancing around the tables. So there are going to be strict protocols. The only thing that might have to be, so that we're not jammed, is we might have to look at altering some of the start times. But that's in the process now of being discussed on, but there's definitely going to be a protocol in place for arriving to the club and leaving the club to sort of handle the changeover.
Great, thank you, Stu. So we've got a question from Joan Belford asking how many people are on the webinar. So we have 8 panelists and I think 56 attendees. If anyone has joined by Zoom and also called in, they might be showing up twice. So, yep, between 52 and 56 people. And we've got a question from Alex that says, have we looked at a delayed start from a financial perspective? For example, 3 series instead of 4, or running later into next summer to allow time to see what happens in the fall. So I'm going to pass that along to Chris to answer.
Thanks, Emily. Yes, Alex, there are many scenarios that we're considering, including a delayed start. But the goal right now is to start sort of at our usual time. Now, we've already canceled the first 2 weeks of the season, which are generally, you know, sort of event weeks, and not a lot of league play in there. But the scenarios we're looking at now are primarily to start at the end of September. It doesn't mean that we're not looking at other scenarios where we have a delayed start. It's just that this is the best information that we're working with right now. As Rob and Tom alluded to, we do think that curling will be safe to do under certain policies and protocols. But the sort of primary factor is going to be what government and public health restrictions are in place at that time, and whether it makes it, whether those restrictions make it viable for us to run.
Okay, thank you. And we've had a request for an update on any insurance issues. So many of you will recall we did have a brief shutdown in late June as we sorted that out. So I will let Chris respond to that as well.
Sure. Yeah, so we were in consultation with a few different parties, some insurance companies, our broker, our legal counsel, and we are confident that with the enhanced waiver, which is the same waiver that many clubs are using across the country, and the same waiver that Curling Canada and our provincial curling association uses for their competitions, and the declaration of compliance, we're confident that our risk is, I'm going to say minimal. It will never be zero, but that the risk has been minimized as much as we're responsible for. Like I say, we can never be certain that the risk will be zero, but with the appropriate protocols, the appropriate transmission control protocols that Tom and Rob had talked about, and the enhanced waiver, we think that we're okay to open at this point.
Can I also add something, Chris?
Mind if I?
Okay, so go ahead, Stu.
So yeah, and the other thing with the whole insurance thing, because I spent a lot of time talking with our provider, is there really is no precedence out there for a COVID case. So there's really nothing that they can go on about if, you know, an organization was negligent or that, and someone got COVID by coming into the club. So on the thing about the director's insurance is that we would have to be shown to be really negligent in running the club and not doing the protocols. And the number one thing they said was that if you're following all the government and health advised protocols out there, that's like number one. Like if you're doing that, that's, you know, covering yourself. But we've also instituted way more safety protocols and increased our cleaning and brought in all the hand sanitizers, the disinfectant, the mask. So it would be hard pressed for someone to show that the club was negligent in running the club. And that was the other part of the insurance part.
Okay. Thanks, Stu. Was that Rob who wanted to?
And if I could just jump in to talk a bit more about the insurance, this is Patrick Boyley.
Oh, we may have lost Patrick. He's been having internet issues. Okay, well, okay. If Patrick hops back on, we can circle back to the conclusion of this question. I guess in the meantime, there are a couple of administrative items in the Q&A. Marina has asked if the Q&A will be posted. The short answer is that I'm not sure. We are recording this, and I'm pretty sure the files that it gives us includes a draft of the Q&A. We'll post a recording of the webinar for sure. And we have a question that says, do we have a case rate that would cause the season to pause? That is maybe a question for Tom and Stu combined. Anyone want to take that one on?
Well, I think that question is also going to be answered by what phase the City of Toronto is in. So that's going to be a driving force. And it's like with this whole committee and putting the protocols and everything together, we have to put the protocols in line with the City of Toronto, the province of Ontario, and the medical professions. If they move us back into phase 2, well, then obviously we have to look at, we're not going to be in compliance with curling because we're going to be too many people indoors. So I think we would fall in line with what the government sees us in, what phase Toronto's in, would definitely play a factor in if we had to scale back curling.
Great, thanks, Stu. So the next question is, will our mask wearing policy be in line with the City of Toronto bylaw regarding exemptions? So Chris will answer that.
Yes, thanks, Emily. The club's current mask policy, which was passed at which was approved at the last board meeting, is in line with the City of Toronto's bylaw. We may make it, based on public health recommendations, mandatory for players to wear masks on the ice. That would be the one area where we would go further than the City of Toronto's bylaw. There are a couple of reasons for that, and I can certainly answer those questions if people are interested. But the short story is, or the short version is, if we think that it's going to make it more viable for us to curl at the same capacity as we would have last season, for instance, then masks may be a requirement. Yes.
Okay, thanks, Chris. We have another question regarding the waiver from Zach. So he says the waiver is much more broadly written than just being related to COVID. Why was all the non-COVID related waiver stuff considered necessary? For instance, what are the implications for our curlers and community members if they are signing over their rights, even if there was gross negligence? Chris, I'm going to toss that to you again.
Yeah, sure. So this waiver is a standard sports waiver that many clubs and many other sports have been using for some time now. As I mentioned, Curling Canada and the Ontario Curling Association have been using it for many years as their competition waiver, as have many other clubs in the GTA and across the country. We felt that we needed a waiver for COVID, and I guess I can say that we just went and we've never had a waiver for members, as I'm sure all of you know, and I think it's in the club's best interest to have that documentation.
I will also jump into Emily. As I brought back to the insurance thing about gross negligence, is that when Curling Canada came out with their return to play, like High Park, with the committee, the board, the staff, like we were way ahead of what Curling Canada was saying. We had done so much work in getting the protocols in place for cleaning, disinfecting, and following the health guidelines. And it's all because of everyone's hard work. And so I think it would be, I think the club is doing its 100% to try and make the club the safest place possible to play.
Okay, thanks, Stu. So we've got a question from Alex. Would curling, I assume it's curling, would curing be permitted within phase 3 once Toronto gets there? Chris, do you want to take that one?
Yeah, thanks, Alex. The short answer is yes. Indoor team sports are permitted. Indoor non-contact team sports are permitted under stage 3 with some caveats. The biggest one being that physical distancing must be maintained at all times. I shared a link in the Q&A. You should be able to find it under Alex's question to the Province of Ontario's stage 3 reopening framework. There are a number of exceptions to the rule, and it does go through team sports. It goes through recreation activities and recreation facilities. I am rambling because I'm scrolling to the page that you want to look at. It's on page 15 and I believe page 18. You'll see some things that could apply to curling and to our club. We're going to be following all of these frameworks, but I can tell you that there are a few things in there that a lot of clubs, including ours, are worried about. Specifically, there's a provision in there that players are restricted to playing in only one league. So those are types of things that Tom and Rob both think that are unnecessary restrictions for a sport like curling. The Ontario Curling Association agrees with them and are working with the Ministry of Health and the Ministry of Tourism, Sport, etc., to see if clubs and curling can get an exemption for that rule specifically. But I would encourage you to look through the whole framework. It's very interesting. It kind of shows you which direction we're heading, and I think barring a second wave or a reversal into stage 2, we'll be in a spot to at least curl come the fall.
Great, thanks, Chris. We have a question from, oh, it just disappeared. So there was a question about whether rentals will be limited or restricted during the upcoming curling season. So maybe Chris and Stu want to?
Yeah, I can. I can quickly touch on that. To the Sigurdsson McDonald clan, thanks for your question. As Stu mentioned, we're going to be eliminating or limiting outside rentals for the time being. I imagine that restriction is going to last until at least January, but it depends on what happens. There may be some outside curlers in the club, and they would be, for instance, from any of our rental leagues that play on a weekly basis that aren't members, or roaming leagues who are members of other clubs that sort of rotate between clubs. They may be allowed, but that will all depend on what phase of the stage 3 reopening that we're in. Obviously, if you're not allowed to play in more than one league, you're not allowed to go from club to club and play. So that would be something that we'd have to see and determine at the time.
Great, thank you. We have a couple more questions. So one is, what is the expectation with catering services this season?
I can take that if you want, Emily.
Yes, please. Thank you, Stu.
So I was just typing an answer. So we're working on the protocols for how curling is going to look after your game, about how we can physically distance, maybe combining the main floor and the top floor, investing in an ordering app. So if we come to the conclusion that we're going to allow this, the mingling after the games, the drinks and that, then yes, food would be part of that. And the app would be, you'd be able to order your food and your drinks. And then the food, the drinks would be, we're either going to do like a pickup table, or they're going to be waiting on the table when you get off, and it'd be the same for the food. So we're working on the protocol for that, but if we do drinks, we are going to do food as well.
Great, thank you, Stu. There was one more question and it disappeared. Did it get answered?
Yeah, sorry, Emily, I answered it. The question was, will house members, and I assume it was, will the number of house members be limited? And as of right now, no, the number of house members we admit will not be limited, but their playing opportunities will be limited, and their club privileges will be limited based on whatever restrictions that the rest of us have to be limited by.
Great, thanks, Chris. So there are no more open questions, so we'll maybe leave. Oh, here we go. Will Little Rocks be running? Oh, great question. Who wants to take this one?
I can take it.
Okay.
I just, for whoever anonymous attendee is, I just wrote TBD into the answering box, so that kind of gives you the where we are right now with that. we're not sure, as Tom and Rob alluded to, kids can get COVID, and likely that they won't be presenting any symptoms. So they're definitely a vector transmission that a vector risk that we're a little concerned about. We're uncertain whether or not we're going to be running any youth programs this year. We've canceled our first youth event, and we'll be considering it in the next few weeks at the next board meeting and in consultation with the youth program conveners. That's really all I can say about that right now. I want to say more, but we just don't have the information.
Thanks. I think Tom and Rob wanted to chime in. They have raised their hand, but you are on mute.
I am not on mute
There we
anymore.
There we go. Hi.
So kids, very often when they're younger, they're more vulnerable. It doesn't appear to be the case with COVID. It remains mostly an adult disease. They get acutely ill or die at an extraordinarily low rate. We don't have any small children in Canada who have died, but we always worry about kids. They're very snotty. I have a 4-year-old. She's a little snot factory, and they may give it to other members of the club. We also don't see a lot of data for kids really spreading the illness. COVID seems to be a strange one, but the data is preliminary. And so I think it's appropriate for the board to say, we're not sure about this yet. It all depends on how you manage it. So I think it's appropriate for the board to keep their cards close to their chest right now as we learn a little bit more as we go.
Yeah, I agree, Tom. I think that once there's a vaccine and we actually see what happens when they open up schools and what the rate of infection for this demographic and what their outcomes are going to be like, we'll be in a better position to say, is it safe for kids to curl?
Yeah.
So it's not even so much just about the impact they may have on the other members, because they've essentially been off school since the beginning of March. We just don't have the data right now to say, how is it impacting this demographic group?
Yeah, I think it's a wait and see is not a terrible idea on this. That's all.
Great, thank you. Oh, okay. Again, there was another question that just disappeared.
Sorry, Emily. It was a question about for those of you that don't know. So 2 things. For those of you that don't know, St. George's Golf and Country Club has closed their curling section, and secondly, there's a group of women who are joining High Park Club at during the day on Thursday mornings. And the question was whether or not they would still be playing. The answer is the plan is for them to play. But again, everything is up in the air right now. Everything is tentative. So that could be the case that might not be.
Great, thanks, Chris. So we see no open questions and no raised hands. We'll give everyone another minute or two in case anything comes to mind. But if not, we do appreciate everyone taking time to come by. We hope that this was informative and helpful for you.
Thanks, Emily, for running a great webinar.
Thanks, Stu. Tom and Rob, if you want to hop in, you can do so. Oh, so we do have a question that says, will there be a cost for taking a leave? I guess I'll maybe answer that because I haven't gotten to answer very many questions yet today. So I guess the first thing to note is that we are sort of working on that. What is very likely is that our sort of position will be that in order to take a leave and retain your status, at least your section status, unsure about team status, you would be asked to pay a house fee, which is, $150 plus HST, which would give you sort of basically house member rights for the season, and then returning section status on your return. Okay.
So a question
Go ahead, Tom. Yeah.
as a member. Rob's got a question as a member.
Oh, okay.
So do you have to make a declaration or declare that High Park is your only club that you're a member of?
Oh, great. I'm gonna once again pass that on to Chris.
Hey.
That's a great question. Right now, the restrictions only allow any of us to play in one league, and I assume that would be one league in one club. The big restriction is that whoever you play with can't play against people in another league. So whether that permits you to play at another club, if you're the only person that overlaps, I have no idea. These are things that GTA clubs, the Toronto Curling Association, and the Ontario Curling Association are trying to get clarification on from public health and from the Ministry of Sport. So to answer your question, I can't answer your question.
Okay.
That's it. Yeah.
Just saying, go and join another club to be in a second league kind of defeats the whole bubble thing.
Patrick's not able to be on, but we asked this kind of question, and his comment in general, and this is just a general comment, it doesn't answer it in detail, is that the government can bring the stick down on organizations like High Park, but they're reluctant to bring it down on people. So, they can't stop one individual from going to different nail salons and so on. So the rules are not as strict on individuals. Whether the club is responsible for policing is a totally open question that we never did get an answer to yet. But Patrick is the one who does a lot of investigation, as well as Chris, looking at that. So that's what Patrick had said, even though he's not available to be here right now.
And on that note, I want to thank all the board for all your incredible work you did over the past couple of months. It's a pleasure working with you guys. And this is why I'm a member of High Park, because you guys care and you do a great job.
Yeah, I got to say that we have an engaged board, and that is step one to getting stuff done. If you don't have an engaged board, it's difficult. So thank you for that. I did want to close off to say, if we didn't answer anything that you wanted answered, just send us an email. And keep in mind that if we speak to you directly, we're not speaking for the board. Don't hold those poor guys responsible. They're doing what they can. If it's officially from the board, it'll come through a club communique.
Okay, thanks very much, everybody. So we see no more open questions. So as Tom said, you can email the committee, you can email the board if you have any questions after today. This slide deck is largely, I think, already on the website. So you should be able to access it there. And we will post this recording in hopefully in the next couple of days. Okay, thanks very much, everybody, for coming. And we are all done, just shy of 90 minutes. Have a great night.
Nice job.